Tia, Chuck needs your help. He fell off the ladder. He fell from really high up there. I can go get the first aid kit.
Yes.
Okay.
When the body suffers a significant force, such as from a high fall, serious injury can result, most notably to the spine. Injury to the spinal cord can result in temporary or permanent paralysis. Paralysis of chest muscles could result in the loss of breathing. Serious shock may also occur. Always make sure it is safe to provide care. If you suspect a spinal injury could have occurred, quickly tell the person to remain still.
Chuck, I can help. Just stay as still as you can.
Suspect a spinal injury when there are obvious injuries to the head, neck, or back, or there is numbness, tingling, burning, or a loss of sensation in the arms, hands, legs, or feet. Activate EMS.
Thanks. Can you call
The lack of
EMS?
symptoms
Yeah, of course.
or obvious injury does not mean that the spine is not injured. If a significant mechanism of injury occurred, it is best to assume a spinal injury exists. After an initial injury, the movement of damaged spinal bones can result in additional injury to the spinal cord or surrounding tissue.
Okay, Chuck. I'm going to help keep your head still until help gets here.
Prevent further injury by restricting spinal movement with manual stabilization of the head. To perform spinal motion restriction, get into a comfortable position behind the person. Cup your hands on both sides of the head to manually stabilize it. Minimize any motion of head, neck, and back. Establishing an airway for an unresponsive person is a higher priority than protecting a suspected injury to the spine. Tilt the head and lift the chin when necessary to maintain an open airway or give rescue breaths. When a head, neck, or back injury is suspected, it is best to leave the person in the position found. However, if the airway is threatened, quickly roll the person as needed to clear and protect it. If you need to leave an unresponsive person with a suspected spinal injury alone to get help, place the person in a recovery position to protect the airway before you go. Comfort, calm, and reassure the person. Reassess regularly until another provider or EMS take over.
Hey, I need some help out here. She fell.
Injury to the brain can occur from a significant blow to the head or by rapid movements of the head that force the brain to bounce around within the skull. Significant swelling or bleeding inside the skull can result in increased pressure that damages delicate brain tissue. Suspect serious brain injury when a blow to the head clearly results in a diminished level of responsiveness.
Call 911.
Surgical intervention may be the only treatment. Activate EMS without delay and manually stabilize the head with your hands. Do not attempt to stop the flow of blood or fluid from the ears or nose. If the person has a seizure, protect the head as much as possible and prevent her from bumping into nearby objects. Do not restrain the person tightly and do not place anything in her mouth. Seizures will generally last for just a few minutes. When the seizure stops, reassess regularly until EMS personnel take over. A concussion is a brain injury that generally results in less immediate or obvious signs. Most concussions are temporary and resolve naturally,
Hold on.
but it is possible for one to progress into a life-threatening
okay?
condition.
Yeah, just give me a sec.
Suspect a concussion after a significant blow to the head or body when the affected person is unable to remember what happened just before or after the incident or recall simple facts
Are
about
we
it.
gonna do corner kicks?
That's what we're doing.
The person may move clumsily, answer questions slowly, or show a change in mood or personality. Additional signs include looking stunned or dazed, headache, nausea, dizziness, difficulty in balance, and visual problems.
Tell you what, let's go have a seat on the bench.
Here.
A first aid provider may be called upon to give advice on whether someone who may have a concussion is okay to return to normal activities. Unfortunately, there is no current concussion evaluation process for use by those trained in first aid. If you suspect a concussion may have occurred, the affected person should be evaluated by a healthcare provider or EMS personnel as soon as possible.
Because she was so unsteady and still confused after climbing with Emma, I'm concerned. She should be evaluated by a healthcare professional.
Okay, I'll take her to urgent care.
Because of the potential progressive nature of concussion, it is best to not allow the person to perform actions that could pose a risk for additional injury until she can be adequately assessed by a healthcare professional.